Throughout the American workforce, pivotal decision-making regarding access to healthcare and affordable coverages is typically relegated away from the individuals and families who are most affected by it.
The majority of employers choose healthcare options for their employees, sometimes with the wrong motivators. They're not making the decision based on every employee at every level.
We have 500 employees. Our 500 employees have 500 different needs. They come from 500 different walks of life at different ages and stages. One could be a young family and their top priority is that their pediatrician is in the network. Another could need to make sure that they've got wellness benefits. But no employer can choose that for an employee by offering a limited number of plans.
Employers are making a decision that may be best for a smaller population of that overall employer group. An individual needs access to those same dollars to make the decision that's best for them or their family.
Under this pervasive influence of corporate control, the escalating costs of healthcare are placing significant burdens on the average American. However, by placing health insurance decisions in the hands of employees, individuals are empowered to spend their dollars to best meet their personal situations.
Fortunately for American consumers and benefits eligible employees, ICHRA, or what's known as ICHRA, passed in 2020.
An ICHRA is an individual coverage health reimbursement arrangement. For employers, the big difference on an ICHRA versus a group plan is you can get away from making those decisions for your employees. You can focus more in on what it's going to cost budgetary-wise, helping plan those costs out. Because when you have a new employee join, you know exactly what they're going to be in. For employees, that's probably the most exciting part of it because you finally have the power of choice. You get to decide what your benefits are going to be based off of your own family needs.
Giving your employees the right to choose their healthcare options is better than a group plan. And we need to ensure that those dollars are equitable and fair, and ICHRAs do that and allow the individual to spend those dollars what's best for them and their families.
As an end-to-end ICHRA administration platform, benefitbay is delivering personalized benefits for the modern workforce.
At benefitbay, we're ensuring that we are able to service the large ecosystem of benefits and ensure that there's transparency end-to-end in the platform. So we help them narrow down what's best for their family, look at the drugs that their family may be needing access to, look at those specialists that are important for their child. And in our technology, we help them to make those decisions, but we help the employer to administrate it. So you're going to need confidence that they can make the right decision and that you're not going to be liable if they choose something that's not for their family.
You come in, we provide education if you don't have it. We have the content and materials for your employees. We help them transition into understanding what ICHRA is, the difference is versus a group. You're working with your employees to give them the right space and the right support, but you're just focusing in on the financial aspect of it.
The front end of our technology allows employers and brokers to model if this would save the employees and the employer money. And we give them the data around if you would have made the decision, you would have had these 3 plans available, but your 300 employees chose 182 different plans. You can really see, wow, the decision I was going to make for my employees was not what they would make for themselves.
As an employer, if your broker is not introducing to you the concept of individual HRAs or introducing you to benefitbay, I would urge you to ask them. Our health insurance and the year-over-year double-digit increases was growing unsustainable. benefitbay and individual HRAs has allowed us now to expand. We have more than 200 plans that our 500 employees are enrolled on. Our employees pay less for their coverage today than they did 5 years prior. Our employees have optimized more than $2.5 million in wages that they otherwise would have spent on a premium cost sharing under a group medical model, and it's been a lifesaver for our company and our employees.
We are a platform, so we're continuously building upon that platform. We take the feedback from our clients very seriously, and then we're working to revolutionize that. We love the idea as it's a one-stop place. You can come into benefitbay, get everything you need, and then you're done.
For us, we're now on the tailwinds of all the hard work we've been doing. I'm excited to finally be seeing the successes, hearing the case studies, knowing that employees are getting better benefits and their employers are saving money.
We are delivering value based on your needs as an individual employee, which looks different for all of us because we're uniquely created.
I'm really excited about the future of benefitbay.
ICHRA made easy. Get on board with the personalized benefit movement by visiting benefitbay.com.